Diabetes. In the diabetes, the person will be not able to control blood sugar, and usually the insulin causes the decreased blood sugar. But in the diabetic patient, there is the destruction of the beta cell of the pancreas. Therefore, there will be the no insulin production, and it causes the increased blood sugar, so that the patient will not able to control the blood sugar. And diabetic are the two type, mainly are of two type: diabetic mellitus 1, also called as the insulin dependent diabetic mellitus, which is usually occur in the early stage of the life, and in diabetic mellitus type 2, it is the non-insulin dependent diabetic mellitus, and it usually occur after late stage of the life, like more than 40-year old, after 40 year of age. And in diagnosis, we confirm the diabetic mellitus on the basis of the diagnosis. First, we will do the oral glucose tolerance test. It will be the more than, if it will be the more than 200, then it confirm the diabetic mellitus. And if fasting blood sugar will be more than 126 milligram per deciliter, then it confirm the diabetic mellitus. And third one is the HbA1c, and it show the blood sugar level of the past 3 month average level, and it will be the, if it will be the more than 6.5, then it indicate the diabetic mellitus. It will come from the diabetic mellitus. And in the management, first of all, we will advise some steps to do for life modification. In life modification, we will advise jogging for 4 hours per weekly, and to avoid less carbohydrate, means to avoid potato, rice, white rice, and sugar. And in medication, first of all, the drug of choice is the metformin for diabetic mellitus type 2. And the metformin is the advantage of the metformin is that it not causes hypoglycemia, and it maximum reduction of the HbA1c level, and it is safe in obese patient because it causes the weight loss. And other drug is the glucagon, and sitagliptin, vildagliptin drugs are the DPP4 inhibitors, and these gliptins are the avoid in the renal failure disease patient. And other drugs are the pramlintide is the amylin analog. This is the only drug we can use in type 1 diabetic mellitus and type 2 diabetic mellitus. And also insulin also can use in type 1 and type 2 diabetic mellitus. And the SGLT2 inhibitor drugs like glifazone is also we can use in the diabetes, and it is it causes glifazone causes the increased risk of the UTI. And bromocriptine drug is a prolactin inhibitor hormone, and it is for the type 2 diabetic mellitus.